Attention seniors, it is crucial to recognize these 7 early warning signs of a stroke. Stay informed for your health and well-being. Annually, approximately 800,000 individuals in the United States experience a stroke. The Centers for Disease Control and Prevention indicates that 3/4 of strokes occur in individuals aged 65 and older. And here is the aspect that raises the greatest concern. In as many as 85% of instances, the body may exhibit warning signs several hours or even days prior to the occurrence of a stroke. However, a significant number of individuals fail to acknowledge them, or even more concerning, they choose to disregard them. It appears to be a manifestation of stress. I experienced a disturbance in my sleep quality. I may have risen too quickly. Such justifications contribute to the alarming statistic that only 1 in 10 stroke patients reach the hospital promptly to receive critical clot-busting treatment. I would like to share a narrative with you. Edward, a 71-year-old retired educator, experienced an unusual numbness in his left fingers one morning. He dismissed it. Subsequently, later that day, there was a noticeable slurring in his speech when he placed his lunch order. He reassured himself that it was merely a case of dehydration. However, that evening, he experienced a collapse in the kitchen. The stroke had been developing insidiously. The indicators were present. However, similar to numerous older individuals, he was unaware of their significance. This video holds significant importance. It is important to note that a stroke may not always present with an immediate and severe onset of symptoms. At times, it communicates subtly. A sensation of tingling in the hand, a statement that fails to convey its intended meaning, a transient episode of dizziness that resolves rapidly. A 2020 report from the National Institutes of Neurological Disorders and Stroke indicates that over 60% of seniors who suffered a minor stroke or transient ischemic attack TIA reported experiencing at least 1 early warning symptom, which they subsequently overlooked. Research indicates that when these signs are identified promptly, the likelihood of achieving a complete recovery improves by more than 70%. Today, I will guide you through 7 preliminary indicators that may suggest your body is approaching the onset of a stroke. I will provide a detailed explanation of their appearance, the underlying causes, and the necessary actions to take if you or a loved one encounters them. After the age of 60, maintaining independence extends beyond mere physical activity. It is essential to remain well-informed. In the context of stroke, the actions taken within the initial hour are critical and can significantly influence the outcome, determining whether an individual may regain mobility or face permanent impairment. Initial indication 1. It frequently initiates in a subtle manner. You attempt to grasp your coffee, yet your fingers fail to react appropriately. Or your leg may present a sensation of heaviness, as if it is not part of your own body. There is an absence of pain, accompanied by an unusual sensation indicating that something may be amiss. It is possible that you may have experienced an unusual sleeping position. However, that minor alteration may represent an initial indication of a stroke. What processes are occurring within your body? In the event of a stroke, there is an obstruction of blood flow to a specific region of the brain. Due to the anatomical arrangement where each hemisphere of the brain governs the contralateral side of the body, a reduction in blood flow can abruptly impact one arm, one leg, or one side of the facial structure. It is frequently observed that the left hand may release the fork, or the right leg may exhibit a sensation of weakness, hindering the ability to step forward. In the absence of oxygen, neuronal cells in the brain start to undergo necrosis within a matter of minutes. Prolonged delays result in increased loss of brain tissue. Here is the evidence based on scientific research. As indicated by the American Stroke Association, over 70% of individuals who have experienced a stroke report an abrupt onset of weakness or numbness, typically affecting one side of the body. A study from 2019, published in The Lancet Neurology, indicated that individuals who disregarded these symptoms had a six-fold increased risk of experiencing a major stroke within the subsequent 48 hours. Research published in the Journal of the American Geriatric Society indicates that older adults frequently do not experience pain during the initial symptoms of a stroke, which can lead them to overlook these critical warning signs. An example from real life. Claire Robertson, 75, from Ohio, experienced an unusual tingling sensation in her left foot upon waking. She believed it was a result of exposure to the cold. Approximately 1 hour later, she inadvertently dropped her spoon during breakfast. She experienced a loss of strength in her left hand. Fortunately, her husband had recently viewed a video regarding the signs of a stroke. He promptly contacted emergency services. Claire received treatment within 90 minutes of the onset of her initial symptom. Due to their prompt intervention, she achieved a complete recovery from what had the potential to be a life-altering stroke. What steps should be taken? If you or a loved one experiences sudden weakness in one arm or leg, numbness on one side of the face, or an inability to lift both arms evenly, it is crucial to seek immediate medical assistance. Do not delay or make assumptions. Call 911 without hesitation. Even if it resolves itself, it is important to remain vigilant, even if you experience a sense of well-being shortly thereafter. In the case of a stroke, every moment that passes can result in significant loss of brain function. Timely intervention can significantly impact the outcome, determining whether one achieves a complete recovery or faces lasting impairment. Indication number 2. Unexpected complications. Articulation or comprehension of verbal communication. Envision this scenario. During a conversation, you may find that the words fail to articulate properly. Or, in a more severe scenario, a person is communicating with you, and while their voice is audible, the content lacks clarity and coherence. Your attempts to articulate may result in slurred, disoriented speech, or may not occur at all. For numerous individuals recovering from a stroke, this often represents one of the initial indicators that a significant issue may be present. It is possible that you have a clear understanding of what you wish to communicate. However, there appears to be a disconnect between your oral communication and cognitive processing. What processes are occurring within the brain? This symptom arises from an interruption in the language centers located in the brain, most commonly within the left hemisphere. These regions are responsible for our ability to articulate words, comprehend language, and convey information effectively. When blood flow is interrupted, even for a brief period, the brain experiences difficulty in transmitting appropriate signals, resulting in disorganized speech or a complete inability to communicate. A 2021 study published in Stroke, a journal of the American Heart Association, indicates that more than 30% of stroke patients exhibit sudden speech difficulties within the first hour of experiencing a stroke. The rapid assessment protocol employed by emergency medical personnel incorporates the letter S. The presentation by speech disturbance is a critical and time-sensitive indicator of a stroke. According to the National Institute of Neurological Disorders and Stroke, individuals who obtain medical attention within 3 hours of experiencing their initial speech-related symptom have a considerably higher likelihood of recovering without enduring disability. This is a true account. Robert, a 68-year-old Vietnam veteran from Kansas, was recounting a story to his granddaughter when she observed that his speech was slurred. He chuckled and remarked, "I suppose I'm simply fatigued." However, she recalled a school presentation regarding cerebrovascular accidents. She requested that he repeat a straightforward sentence, but it emerged in a disordered manner. She contacted emergency services, and medical professionals confirmed that he was experiencing a mild ischemic stroke. Due to her prompt intervention, Robert received treatment within the essential time frame. Today, he has resumed the enjoyable activity of reading books aloud to his grandchildren. What to monitor closely? Please remain vigilant for experiencing an abrupt onset of slurred speech, articulating incorrect phrases inadvertently, experiencing challenges in comprehending straightforward sentences, difficulty in identifying common items, communication that lacks your authentic voice. If symptoms manifest abruptly and do not show improvement within a few minutes, it is imperative to contact emergency services immediately. In the event of a stroke, the absence of communication can be particularly concerning. This situation constitutes a neurological emergency. Timely intervention significantly enhances the likelihood of a complete recovery. Indication number 3. Acute visual disturbances in one or both eyes. At one moment, you are engaged in watching television. The subsequent moment, a section of the screen dims, or you find yourself reading the newspaper, and the words begin to blur or fade away. Some individuals report experiencing a sensation akin to a gray curtain descending over one eye. Some individuals describe it as akin to gazing through a fractured mirror. The onset can be abrupt, and the symptoms may resolve just as quickly. That is what contributes to its ease of dismissal. Sudden vision loss, particularly in one eye, can frequently serve as a subtle indicator of an ongoing stroke. What is occurring within your brain? The optic nerve and visual cortex, responsible for processing visual information, depend on consistent blood flow, particularly from the arteries located at the posterior aspect of the brain. When a stroke impacts these regions, it may lead to a temporary or permanent disruption of signals transmitted from your eyes to your brain, despite the eyes being in optimal health. Some individuals who have experienced a stroke report sensations such as, "My eye felt fine, but it was as if my brain was unable to interpret what it observed." A report from the American Academy of Ophthalmology indicates that sudden, painless vision loss in one eye is a significant concern, potentially signaling a retinal artery occlusion, commonly referred to as a stroke in the eye. The National Eye Institute indicates that as many as 25% of individuals experiencing this condition may subsequently endure a complete stroke within a week. A study conducted in 2020 within the field of neurology indicated that elderly individuals experiencing sudden vision loss, particularly in the form of blurred, double, or tunneled vision, exhibited a 2 to 4 times increased likelihood of experiencing a stroke in the subsequent 30 days. A narrative grounded in reality. Ms. Lorraine Jacobs, 79, was engaged in the activity of baking cookies. when she experienced a sudden dimming of vision in her left eye. She applied gentle pressure to the area, blinked. The symptoms resolved shortly thereafter, leading her to dismiss any concerns. However, the following day, the situation recurred, and it was exacerbated. Her daughter transported her to the emergency room, where medical professionals identified that she had suffered a transient ischemic attack in the visual region of her brain. Due to timely intervention, medical professionals were able to avert a significantly more severe stroke that could have occurred days later. What to be vigilant about? Please remain vigilant for experiencing abrupt onset of blurred vision, diplopia. Experiencing a partial or total loss of vision in one eye. Difficulty perceiving objects on one side, particularly when colliding with them. Experiencing a sudden loss of the ability to read or maintain focus. These may not cause discomfort. It is possible for them to appear and disappear. However, it is important not to overlook them. A brief episode may indicate a transient ischemic attack, commonly referred to as a mini stroke, and serves as an important warning sign that a more significant stroke could occur in the future. Should you experience a sudden alteration in your vision, even if it lasts only a few minutes, it is imperative to contact emergency services immediately. In the event of a stroke, it is often the case that visual perception occurs prior to cognitive recognition of the situation. Indicator number 4. Experiencing sudden dizziness, issues with balance, or a lack of coordination can be concerning symptoms that warrant further evaluation. Upon rising from a seated position, you may experience a brief sensation of the room tilting. As you take a few steps, you may experience a sensation of instability, as if your balance has been compromised. Or perhaps you lean down to retrieve an object and experience a sensation of instability, as if you might lose your balance. These are not merely indicators of advancing age. In numerous elderly individuals, the onset of sudden dizziness or difficulties with balance may serve as one of the initial indicators of a stroke, particularly those impacting the cerebellum or brainstem. It is important to recognize the potential hazards involved. It is commonly believed that the underlying causes may include dehydration, hypoglycemia, or general fatigue. Thus, they remain in a state of anticipation. During the waiting period, the stroke continues to advance. What processes are occurring within the brain? The cerebellum, situated at the lower part of the brain, plays a crucial role in the coordination of movement, maintenance of balance, and regulation of posture. When a stroke impedes blood circulation to this region, the body faces challenges in maintaining an upright position. You may experience a sudden sensation of unsteadiness while walking, or perceive that the ground is moving underneath you. Strokes occurring in the brainstem pose a heightened risk, as this area regulates essential functions such as respiration, heart rate, and motor control. The findings indicate that, as per a 2022 report from the American Stroke Association, more than 40% of individuals who experience posterior strokes in the back of the brain present with dizziness or imbalance as their initial symptom. A recent study published in the journal Stroke, affiliated with the American Heart Association, indicates that 60% of cerebellar strokes in older adults are misdiagnosed during the initial emergency room visit, frequently being confused with inner ear issues or vertigo. Older adults experiencing balance-related symptoms who postpone seeking medical attention are at a twofold increased risk of enduring permanent disability in comparison to those who receive treatment within the initial 3 hours. An authentic narrative. Mr. William Harris, aged 76, was engaged in gardening activities when he experienced a sudden onset of dizziness, causing him to nearly lose his balance upon standing. His spouse believed he was merely experiencing a sensation of lightheadedness. However, 20 minutes later, he experienced difficulty in stepping forward and grasped the wall to prevent a fall. Upon examination in the emergency room, imaging studies indicated a cerebellar stroke, a condition that could have resulted in significant mobility impairment had timely intervention not been administered. Today, William walks with assurance, having heeded the cautionary advice provided. What should be monitored? Experiencing a sudden loss of balance or unsteadiness while walking. Difficulty maintaining an upright posture. Experiencing sensations of dizziness or a perception that the environment is rotating. Challenges in reaching for objects or experiencing a loss of coordination. Experiencing a decline without an apparent cause. These symptoms may appear benign or be easily attributed to the aging process. However, when these symptoms manifest abruptly and you have not encountered them previously, it may indicate that your brain is signaling a need for assistance. In the realm of stroke care, a decision made within a mere 10 minutes can significantly impact the subsequent decade of your life. It manifests with sudden intensity, a severe, throbbing headache, experiencing a sudden and intense sensation that is unprecedented in nature. It is often characterized as a sudden and intense sensation, akin to a thunderclap. Some individuals report experiencing a sensation akin to pressure building up and subsequently releasing within. It may present with symptoms such as nausea, blurred vision, or potentially vomiting. However, it frequently presents itself unexpectedly. Many individuals have experienced headaches at some point in their lives due to stress, missed meals, and insufficient sleep. This particular type of headache presents differently, and for certain elderly individuals, it may be the sole indicator of intracranial hemorrhage. What is occurring within your cerebral structure? This particular type of headache is frequently linked to a hemorrhagic stroke, a condition that arises when a blood vessel in the brain ruptures. The pressure resulting from the hemorrhage can rapidly compromise adjacent brain tissue, heightening the likelihood of coma, lasting disability, or fatality. In contrast to ischemic strokes that obstruct blood circulation, hemorrhagic strokes frequently present without any preliminary indications, with the exception of one. A headache that presents as unusual and atypical. Research indicates that, as reported by the National Institute of Neurological Disorders and Stroke, 1 in 10 strokes occurring in older adults are classified as hemorrhagic. Most of these cases initiate with an abrupt and intense headache. Research published in the New England Journal of Medicine indicates that more than 70% of elderly individuals who suffered a hemorrhagic stroke reported their headache as the most severe pain they have ever encountered. Postponing treatment by as little as 30 minutes in these situations can elevate the risk of mortality by more than 50%. An authentic account. Mrs. Angela Ruiz, 73, had just completed her morning crossword puzzle when she experienced a sudden, intense pain at the back of her head. She attempted to recline, believing it was merely a migraine. However, shortly thereafter, she started to slur her words, prompting her daughter to contact emergency services. Upon examination at the hospital, medical professionals confirmed the presence of a minor intracranial hemorrhage. Due to the prompt treatment she received, Angela was able to avoid surgery and achieved a complete recovery. Her physician stated unequivocally That call was instrumental in saving your life. What to be vigilant about? A headache that presents abruptly and is characterized by intense or explosive pain. This discomfort is distinct from your typical headaches. Headache accompanied by nausea, confusion, or alterations in vision. A sensation of pressure within the cranial cavity. The etiology remains unclear. There is no indication of fever. There is an absence of sinus discomfort. No signs of dehydration are present. Headaches may arise from a variety of underlying factors. However, if you are over the age of 60 and experience a headache that is sudden, intense, or feels atypical, it is advisable not to delay seeking medical attention. Please contact emergency services immediately. Please schedule a checkup. In instances of intracranial hemorrhage, any delay in intervention can result in severe consequences. Indicator number 6. Acute onset of disorientation or difficulty in comprehension. Common daily occurrences. You find yourself in the grocery store, and unexpectedly, the purpose of your visit eludes you, or an individual poses a straightforward inquiry, and you find yourself hesitating, struggling to articulate an appropriate response. As you survey your surroundings in a well-known environment, a fleeting sense of disorientation may arise. It is not uncommon for individuals to encounter lapses in memory or cognitive function occasionally. Experiencing difficulty in recalling a name, inadvertently losing your keys. However, this situation is distinct. It is more than mere forgetfulness. It appears to be an abrupt state of disorientation, a disruption in your cognitive functions, affecting your capacity to think, comprehend, or process information that typically occurs with ease. What processes are occurring within the brain? When a stroke impacts the frontal or parietal lobes of the brain, which are crucial for reasoning, language, and memory, even basic tasks may become exceedingly challenging. It is possible that you have the desire to communicate, yet find it challenging to articulate your thoughts. You might experience a sensation of mental cloudiness, where your thoughts seem disorganized or elusive. Clinical studies have validated this information. A study published in JAMA Neurology in 2018 indicated that more than 25% of elderly individuals experiencing a mild stroke present with confusion or disorientation as their initial observable symptom. The American Stroke Association indicates that symptoms such as confusion, impaired judgment, and memory difficulties are more prevalent in strokes affecting the right hemisphere, which frequently remain undiagnosed for a longer duration compared to those impacting the left side. In individuals aged 65 and older, the presence of delirium or an abrupt cognitive decline may occasionally be the sole indicator of an ongoing stroke, particularly in those with prior memory concerns. A notable case involves Henry, a 74-year-old former postman, who experienced a moment of confusion while preparing coffee, forgetting the operation of a machine he had utilized for many years. His spouse inquired about his well-being. He gazed at her with a vacant expression and responded, "Could you remind me of our destination?" She believed it to be merely a case of mild confusion. However, within the hour, he was unable to remember the names of their grandchildren. The patient was promptly taken to the emergency room, where medical professionals identified a minor cerebrovascular accident impacting the frontal lobe. Due to the timely intervention, his cognitive functions were restored in a matter of days, allowing him to return home without any lasting effects. What should be monitored? Challenges in comprehending both verbal and written communication. difficulty adhering to straightforward directives, disorientation regarding your current location or the time of day, expressing thoughts that lack clarity or coherence, a rapid alteration in an individual's personality or conduct. A stroke can have implications that extend beyond physical health. It has the potential to compromise your mental clarity, your awareness, and even your identity. If an individual presents with sudden confusion or a noticeable change in behavior, it is imperative to take immediate action. Time is critical for the brain, and confusion may signify a desperate plea for assistance from the brain. Experiencing abrupt difficulties with ambulation or a decline in balance and coordination. Upon standing, you may notice an abnormal sensation in your foot. As you attempt to traverse the room, you may notice an irregularity in your gait, a sensation of weakness in your leg, or an impression that the floor is sloping beneath you. You attempt to grasp a glass of water, but fail to make contact. Or you may experience difficulty in buttoning a shirt, holding a spoon, or tying your shoes. These experiences may seem unusual, perhaps even awkward, but they could signify more than mere clumsiness or the effects of aging. This could indicate a potential neurological concern. What processes are occurring within the brain? The processes of walking, balance, and coordination are dependent on a complex interplay of various brain regions, with particular emphasis on the cerebellum, motor cortex, and brainstem. When a stroke impacts these regions, even routine movements can become significantly difficult. The brain is unable to transmit seamless, regulated signals to your extremities, leading to a disconnection that may result in your body stumbling, dragging, or freezing. Here are the findings from recent medical studies. As indicated by the National Stroke Association, more than 35% of individuals aged 65 and older who experience a stroke report an abrupt onset of difficulty in walking or a loss of balance within the initial 30 minutes of the event. A study published in 2021 in Frontiers in Aging Neuroscience indicates that impaired gait, characterized by slower steps, a wider stance, or dragging one foot, serves as an early indicator in more than 40% of mild to moderate strokes among seniors. Notably, falls occurring within the initial hours of a stroke frequently lead to delayed diagnosis, as caregivers may misinterpret these symptoms as weakness, arthritis, or fatigue, a narrative grounded in reality. Mr. Leon Bradley, aged 80, was engaged in his routine morning walk with his dog when he experienced an unusual sensation in his right foot. Approximately midway down the block, he noted that his foot began to drag, and subsequently, he was unable to lift it at all. He attempted to reverse his direction, but inadvertently collided with a fence. Fortunately, a neighbor observed the situation and promptly contacted emergency services. Leon experienced a mild ischemic stroke, affecting the motor region of his brain. Fortunately, due to the prompt arrival of medical assistance, he was able to walk unaided within 2 weeks. What should be monitored? Experiencing sudden difficulty with ambulation or unsteadiness. Experiencing difficulty with one foot or leg. Experiencing a lack of coordination in your hands or arms. Experiencing difficulties with basic movements, such as fastening clothing. Experiencing sudden dizziness or a sensation of swaying while in a stationary position. A stroke may not always present with dramatic symptoms. At times, it may present as a minor misstep, an overlooked movement, or a tremor in the hand. However, when these symptoms manifest abruptly, particularly if they are unfamiliar, It indicates a pressing need for immediate attention from your brain. Please refrain from making assumptions. Please do not delay. Please contact emergency services without delay. A stroke does not always present itself with the urgency of sirens. The sight of collapsed individuals or other dramatic occurrences. Occasionally, it may initiate with a subtle sensation, an unusual tingling in the arm, a misarticulated word, or a glass of water that unexpectedly falls from your grasp. Each of the 7 signs we discussed today, sudden numbness, slurred speech, vision loss, imbalance, intense headache, confusion, trouble walking, may appear minor individually, but collectively they can significantly impact outcomes, influencing recovery versus disability, independence versus long-term care, and ultimately, life versus death. The CDC indicates that more than 80% of strokes can be prevented, not only through the management of risk factors such as blood pressure and cholesterol levels, but also by being aware of the symptoms and seeking prompt assistance. If you or a loved one encounters any of these symptoms, even if only for a brief period, it is crucial to seek immediate attention rather than waiting to see if they resolve on their own. Please contact emergency services immediately. Please proceed to the hospital promptly. Allow medical professionals to determine the underlying issues. In the case of a stroke, it is crucial to recognize that time is of the essence. Each passing second can result in the loss of additional brain cells, neurons that facilitate ambulation, communication, cognition, and overall existence. At Senior Health Tips, we hold the view that the process of aging should be accompanied by knowledge, which encompasses the ability to recognize when your body is signaling that there may be a significant health concern. Please disseminate this video. Engage in this activity with your partner. Distribute it to your offspring, your community members, and those who provide care. It is essential that we pay close attention to the indicators present. If this video has been beneficial to you today, I encourage you to click the like button, subscribe for ongoing updates, and activate the notification bell to ensure you do not miss any health tips that may be crucial for your well-being. I appreciate your presence here today. Prioritize your well-being. Maintain your resilience. It is important to acknowledge that one is never too advanced in age to heed the signals from their body and respond with determination.